Hi, this is Dr. Rob Peltier, Chief Medical Officer at North Oaks Medical Center in Hammond, Louisiana, with a weekly COVID update. It's been a couple of weeks since I've had a chance to do an update here, but the news really hasn't changed, as we all know, in the past couple of weeks. So there really hasn't been anything to update you guys on. I do want to go over a few things with you and a few concerns I have, especially about patients returning for procedures that they've been putting off for a long time and or laboratories and those kind of things. But first, let's talk a little bit about where we are right now. In Louisiana, we still have a significant number of cases, enough that the governor, as we all know, has pushed back our start date from today, the 1st. Everybody was looking forward to the 1st today, but he's pushed it back a couple of weeks to May 15th, and we'll make another decision that we'll hear about probably on May 11th, is when he said that he would speak to us again about that. I have been in touch with the state epidemiologist in our weekly phone call every Tuesday. A number of chief medical officers from across the state get online with the Louisiana Department of Health through the Louisiana Hospital Association and have a discussion about what we're seeing clinically to coordinate with their numbers to ensure they all mesh up. Dr. Peltier, our state epidemiologist, has been very transparent with all the numbers that they've been using. One of the numbers that we've seen here in Tangipahoa Parish is that our number of cases per capita, that means how many people compared to the population that we have here, has been relatively plateaued. It's stayed between a 0.1 and a negative 0.1 slope, meaning flat. And but all of our other numbers look great. Our hospitalization numbers, our use of ventilators, our intensive care unit beds, all of those have consistently gone down. And that's all been great news. Our governor's been very conservative in moving back towards opening up businesses and decreasing social distancing, and I think appropriately conservative. Louisiana, as we know, had one of the highest per capita rates of hospitalizations and ventilator uses, mostly in the Orleans Parish and New Orleans area, but we've certainly seen still increasing cases in 3 regions in our state. And in our region, Region 9, like I said, we have plateaued in cases over the past, and that's over a 21-day period. Really, over the past 2 weeks, we've been looking much better. So I'm hoping that with all of those things that we see him on May 11th say that the 15th we can start doing some decreased social distancing. He has mentioned that masks will be recommended for everybody to use. And when I've been out to get milk for my kids and those kind of things, I've seen a lot of people wearing masks. It is absolutely appropriate. It can be as simple as a cloth bandana, anything to cover your nose and mouth to prevent you from possibly having an early COVID case and spreading it to the rest of the community. So, anything you can do to help your neighbor, it's called good citizenship, and we should all do it to try to help that out. Now, where I really have some concerns is this past Monday, we at North Oaks here, as well as all of my fellow chief medical officers across the state on Tuesday, noted that when the governor said that all the time-sensitive surgeries that we've been putting off to maintain and make sure we had PPE and resources and those kind of things, we expected this explosion of people coming in and prepared for it, and we have not seen that. In speaking with many of my surgeons who have called patients that have even tumors that they need to biopsy and those kind of things, there seems to be a significant fear of coming have those procedures done, and most people are saying they would like to wait. I implore all of you to make sure you have a conversation with your doctor about the risk associated with not doing something. The risk of COVID and obtaining that disease currently right now is extremely low, especially in a facility where we are screening patients coming in. That's both asking them about symptoms, taking temperatures, and that's true of the patients as well as all the healthcare workers. Every day upon entering this facility, get screened, get my temperature checked, and we're all required to wear masks throughout the facility at all times when we are interacting with with anybody else, whether that's a patient and or any of our fellow co-workers. So there are a number of measures that are being taken to do that, so that everyone is safe, because we don't want to spread this not only to our patients, but to our fellow workers. We need our healthcare workers to continue to be able to provide you world-class care, which is what we are trying to do. So please don't have a significant fear, and just a reminder that not doing something in a timely manner can have dire consequences to your health. So speak with your physician about the appropriateness of putting off a procedure, and make sure that if you do need that procedure, you come and you have it done. There's always a risk whenever you have a procedure, whether that is a surgery or an x-ray or anything else. There's always a risk, but it's very minimal, and not having those things done is also a risk. So balance the risk and make sure you are doing what's right for you. I would also tell everybody that we are starting to see some hope of treatments and earlier vaccines. Dr. Fauci, now becoming a household name, earlier this week talked about some of the antivirals, one in particular that has shown promise. Remdesivir is a drug that we can use for compassionate care here at North Oaks if needed still, and be part of those studies as we go forward. I would just remind everybody that we like to use science, we like to use data, and it's still early in all of these trials to see how effective medications are. Not only how effective they are, but what doses we should use. Are there any side effects associated with them? All of those things we try to balance. So there's always risk and benefit associated with that. Now, as far as a vaccine, I was also glad to see that the national government has looked towards manufacturing even before some of the vaccines have been approved. It's my understanding that they will be producing some of the leading candidate vaccines, so that if one does turn out to be a good candidate for a vaccine, that we have a significant number of them produced so that we can start giving them to our population as quickly as possible. But again, like anything, take some time, so be patient, be safe. If you have symptoms, remember you can always call our hotline number at 985-230-2778 and have a video visit. We are continuing to do that service. It is not a charged service. So please call and we can screen and get you to an appropriate area for evaluation if you're having any symptoms. Fever, chills, cough, shortness of breath, loss of smell, loss of taste, any of those things that you've heard over and over on TV. Get checked out early, self-isolate if you're unable to come in right away. We continue to do testing here at North Oaks. We have tested almost 2,000 people here just through our drive-through in the hospital. We've had approximately 550 or so positive tests here in Tangipahoa Parish. If you are having those symptoms, your doctor can arrange for you to have that drive-through testing to confirm whether you have COVID or not. Luckily, that testing, the turnaround time, how many days, has gone from almost 7 to now, we are at 2.05 days on average from when somebody gets a test until it's resulted. So in general, we're getting it in 1 to 2 days. The most 3, depending on if it's done late in the day, but the turnaround time is much faster. So our testing ability has gotten better, our supplies are getting better, the population is getting better. Everything that we've hoped for to happen over the next couple weeks has been happening, with the exception of, like I said, please, if you need something done, if you've been putting off your health care, laboratories to monitor therapeutic drug levels, laboratories to monitor blood counts and those kind of things. If you're anemic, please talk to your doctor about the appropriateness of doing that, or whether it's okay to put that off, and know your risk of not doing those. If you have any questions, you can visit our Facebook page. We have a Twitter account. You can go online at www.northoaks.org/coronavirus and get all of these videos that we've done in the past and a lot of information that can help you as you're going forward. Continue to stay safe, continue to do the social distancing. We, on behalf of all of us here at North Oaks, thank you for what you have done. It's been working. Our population is more healthy, and thanks to all of those people who have sent us meals, sent us good wishes. I want to make a special shout out to Punjabi Dhaba, who has donated over 10 meals to our staff here and continue to do that. The outpouring of love in our community in so many ways has really helped the morale of our staff. So until next week, stay safe and stay healthy.